The other common bowel control problem is constipation. And constipation can mean lots of things to different women. Some people think you're supposed to have a normal form stool every day. But in fact, we know that many people do not. Some have one or two stools a day. Some have only one or two bowel movements a week. And all of those fall within a normal range. And it really depends on what's normal for you. Certainly our bowel habits change depending on our activity, depending on how much food we eat. One of the things that I see most common in my patients who have constipation is that they try not to eat because of fear of bloating and not being able to go. And this is one of the worst things that you can do. One of our natural mechanisms for having bowel movements is that when we eat, you stimulate what we call the gastrocolic reflex. When the stomach expands, it sends signals for the GI tract to start having contractions and to move whatever stool and food is in our GI tract, to move it on down the tract, so to speak. So it's very important to eat regular meals. It's important to have enough fiber and enough water in your diet to try and keep your stools at a normal consistency. Adding fiber for many women is important, and we generally like to see women have like 30 grams of fiber a day. So again, it's important to look at your diet and perhaps see exactly how much fiber you're having. We try to use non-fermentable fibers in terms of supplements to try and increase that in your diet. Exercise can be very important in terms of its overall well-being, and we know that too can help with constipation. There are lots of things, other types of osmotic agents and other medications that your healthcare provider can give to you. For some women, bowel control difficulties can lead to pelvic organ prolapse or rectocele because of straining. It can also cause problems with how the muscles work. And again, physical therapy may help some women as to try and coordinate the evacuation of your stools and learn how to relax your muscles in order to have a bowel movement. There are many, again, generally non-surgical things that your healthcare provider can offer. Warning signs: if you see blood in your stools, if you see a rapid change in your bowel movements, either going from a solid to a liquid, and these are things that really should prompt you to see your physician or healthcare provider. For women over the age of 50, we routinely recommend a colonoscopy screening for cancer. In most cases, changes in bowel habits are not related to a malignancy, so this should not make you anxious, or you should not be fearful to seek your help when you have a change in bowel habits. But if you do see blood, if you have any sorts of pain, it's important then to certainly get right in and see your physician. So maintaining good, healthy bowel habits, whether it's constipation or fecal incontinence or accidental bowel leakage, is a part of what a female pelvic medicine reconstructive surgeon is what we are trained to do. We work with our gastroenterologists and our colorectal surgeons, physical therapists, our nurses, to try and help women with these life-altering conditions.